Just to say thank you to Public Health England for inviting me here today. I guess I found out on my way here that today is World Hello Day, so hello everybody. And I will be talking about the work that we are doing in Lambeth to address childhood obesity. And I will be talking about it in relation to the NCMP, but more particularly about the specialist healthy weight school nurse who is part of the childhood obesity program. Just before I start, really just want to acknowledge colleagues, Vida, who's here, who works with me on this program, and Graham Kelly, who is the specialist healthy weight school nurse. So I'll just quickly run through, at the start, a bit of background around where we were in Lambeth 3-4 years ago, a bit around the Children's Healthy Weight Program, because the specialist school nurse, which I'll be focusing on, is pivotal to that, and it's very much part of that. And although I'll be focusing on the school nurse, I don't want people to forget that it is part of a program, and there are interconnections between all the interventions within the program. Also, this work, in a sense, is developmental. And so there is a lot of learning, and I will share that with you and also let you know where we hope to get to. So just very, very briefly, Lambeth, inner city, lots of deprivation. As of 2009-10, we had significant high levels of childhood obesity, both for reception and year 6, as compared to London. Pleased to say that the gap has closed since then. But at that stage, we also did not have a coordinated approach to addressing childhood obesity, and quite frankly, we weren't really doing very much around it. We were very fortunate that the PCT, with a lot of, I guess, pressure and recognizing that we did have one of the highest levels of childhood obesity, decided to make a commitment to address childhood obesity and set a goal to do so in 5 years. So Public Health was asked to do a modelling exercise to try and estimate what the need was, and for us to prioritise what interventions we should put into place and to develop a business case. And so we did this, but what we did was that we actually modelled 3 scenarios with different levels of investments and different outcomes. So we ended up with 3 different trajectories, and we asked the PCT to decide how much investment they wanted to put in and how quick they wanted things to be addressed. Alongside that, we recognized that because we'd never had a coordinated approach to childhood obesity, it was really important that if we were thinking of commissioning interventions, that we needed to have a good healthy weight care pathway in place. And we recognized the importance of making this a multi-agency one, because we were very keen to ensure that the whole of society basically was fully engaged. We have heard about how sometimes it is difficult to be able to identify the weight status of children, how that's assessed, and what to do. So very much the care pathway was developed, and we've got examples of our care pathway to my right on the posters there. And the interventions we prioritized were based on the published literature, but also local evaluation, engagement with a whole range of people, including children and their families, to try and find out what kind of intervention would work for us. And we ended up with, well, 6 areas where we said we were going to really focus on. One was promotion of breastfeeding. The other was around training and capacity building for both health and non-health professionals, enabling them to understand some of the issues, but also for them to feel confident to raise their issue when they were speaking with either the children and or their families. We recognized the important role schools had to play, not just with the NCMP, but generally in terms of promoting healthy weight. We developed weight management services, which are very much based on what evidence was out there, but also the children, families' feedback was really, really important for us in shaping the kind of weight management services that we wanted. And I will be talking about our specialist healthy weight school nurse post, which was created specifically as part of the interventions. And I think the recognition that we were really fortunate that the PCT did commit then to a 5-year program, and we were very keen to ensure that this was an opportunity to generate evidence. And so evaluation's got an important part of the work we're doing. So our specialist healthy weight school nurse, well, what was the rationale for creating a post? Because we have school nurses some of them are involved in the NCMP. But I think there was the recognition that we were developing a care pathway which was multi-agency, different disciplines, could be used in different settings, and it was really important to have some coordination around this, or somebody who had some oversight of the whole care pathway. We recognized the role of the NCMP, and we didn't want people to see it separate from the whole kind of childhood obesity program. We felt it was really important that that was one mechanism that we could use to address childhood obesity, and we wanted to make sure that was very much embedded in our pathway. Our school nursing team are fantastic, but they have very, very heavy workloads. A lot of them are really keen to do much more health promotion, but there are lots of challenges, and I think they realized that there was only a certain amount of capacity they had, even though they had good intentions, to follow up the NCMP children. We've heard today already about the varied levels of knowledge and understanding with even our health professionals about, whether a child is overweight or not. And we recognize that actually the practitioners out there did need a lot of support. We realized that in an area like obesity, where it is multifactorial, quite complex, the importance of relationships across the different key stakeholders was absolutely imperative, actually, to get things going. And we also recognized that, in a sense, one size doesn't fit all with children and families. And we wanted to ensure that whatever support we were offering our children and their families were the most appropriate, and they were timely as well. And most particularly our vulnerable families, we wanted to ensure that whatever process they took, they would be well supported. So based on that, we felt that a new role would be developed within the school nursing team, who would focus on healthy weight. And this is just an overview, really, of the role of this school nurse. We were very keen to make sure that this role was part of the school nursing team. We didn't want to see it in isolation, but working as part of. And they had a responsibility around the coordination of the NCMP, the relationships with schools, the whole school family, and that includes staff and parents. Our different health and social care practitioners, other key workers who worked with children and families. But also they had a role around following up children, assessing the family situation, providing tailor-made advice, and monitoring and being able to follow up the children even after the intervention. So far, as I said, this is a newly developed role, and we make sure that we are learning as we go along, and this has really helped us to further develop the role, but also understand a bit more about what the local challenges and opportunities are. I think it's been absolutely brilliant being part of a kind of developmental piece of work, because I think it's really allowed for innovation, particularly around relationship building. So we've talked about the NCMP and how parents react or don't react to receiving a letter. I think it's really interesting, as part of the work of the specialist school nurse, found out that some parents didn't bother to open the letters in the first place, since they actually have to opt out. It doesn't really matter whether they see it or not. And so quite often, if they do end up reading the results letter, it's quite a shock. They don't really know what's happened. So our school nurse has introduced this pre-NCMP session with parents, really sitting down, talking to them, letting them know what's going to happen, letting them know they're going to get a letter beforehand, and they may get a letter afterwards that might be a bit of a shock to them, but actually preparing them, but introducing himself as well. He also recognized that this approach probably works much better with the reception year children and their parents. But with the year 6, he felt that it wasn't just important to engage with the parents themselves, but that the children actually were the key people to engage and to introduce himself to, because he felt if the children were engaged, they're more likely to encourage their parents to support them. So what he has started doing and is planning to do is to actually go into schools, into year 6 classes, maybe their maths lesson, talk about the issue of weights, and then introduce the NCMP, and just get to know those children as well, so that further down the line, if they do need support, they know there's someone they can go to. Our school nursing team have been really, actually, they've fully appreciated. I think at the start they felt a bit threatened about why do we need a specialist, but I think they've been really pleased to have somebody in the team who can support them and give them a lot more confidence around raising the issue. As I said, they do undergo the training, but I think the practical day-to-day, it's just good for them to know that there is someone there to discuss with. I mentioned earlier on the capacity building work. I think as the school nurse has gone around speaking to different professionals, they've recognized that actually they may have a perception of obesity, which is not quite consistent with what the evidence is telling us, and a lot of them have opted actually to attend the free healthy weight training that we offer. As I mentioned, that across the care pathway, there are a series of interventions, and quite often not quite sure where the families fit. So not just basing it on the weight status of the child, but actually the whole family context we recognize is really important in being able to refer people to the right places. So, for instance, there's some families that perhaps the child may be eligible for a level 2 service, but actually the family situation is such that, attending a 10-week program is just not possible, but actually going to a parenting class, 2 or 3 times may be the best solution for them at that point in time. The term slippery fish actually comes from the specialist school nurse who says actually a lot of these families are like slippery fish in his hands because he starts speaking to them on the phone. They come up with every excuse not to engage, and it's such a challenge to just keep hold of them. But I think the exciting thing is that once you can keep hold of them, and it's back to the relationship building, the engagement has been really, really positive. And I guess one of the greatest things about having a role like this is that it enables us to take a holistic approach to addressing obesity. We have the opportunity not just to look at the weight status, as I said, but because the specialist school nurse is part of the school nursing team, has access to the child's records, they can see what else is happening to that family. And that provides a better assessment of the kind of support that the child requires. So that's been really, really important for us. We also realize that this approach has enabled us to identify some of the root causes of the child's weight in the first place, and actually perhaps a weight management service is not the most appropriate, and it's actually one of the determinants of obesity that needs to be addressed within that family setting. I've talked about this quite, literally in 10 minutes, but actually it's been a lot of work, and I think we did underestimate the amount of time it would take, not just to set up the different elements within the program, but actually, getting it going. And I think we've been very fortunate that we did have that commitment for a 5-year program, which is very much in line with what NICE is telling us, and we've been able to get the support of the local authority to carry on with it. So it is a 5-year program. But I must say that we've spent a long time actually getting things up and running. We know with relationship building, people have different perceptions about the issue of obesity. And actually the relationship building, it's not really, quite often it's actually addressing people's views and starting where people are at and working with them, and that takes a lot of time. The demands of the job, I showed you a picture of all the different relationships, and I've talked about all the kinds of work that he does, and it is a very demanding job. It is very, very demanding indeed, also because it's not just, as I said, the weight status, it's the whole family context that the school nurse gets to understand. And in doing that, actually we begin to unearth even more local needs, and we recognize that actually a lot of some of the needs that we have identified goes beyond obesity, and we do have the links with other relevant services. So I'll just talk you through 2 examples of families that our specialist school nurse has seen. So one family had an older child who had been part of the NCMP a few years ago, got a letter, but they just didn't bother to follow up. Our specialist school nurse attends coffee morning in school where this mother is present, just talks generally about unhealthy weight, and he left his contact details. The mum said she was really embarrassed to bring it up at the coffee morning, so contacted the school nurse afterwards, talked about actually her denial of her older child's weight status, and recognized that actually her child probably does have a problem, and was actually worried about her other child who was yet to be part of the NCMP. And the good news is that the school nurse reviewed both children, and they were referred to our level 2 service, and they so far have been very, very engaged with that service. The other family that I'm going to showcasing is that of a child who was part of the NCMP. And the carer of that child received the feedback letter, was not necessarily shocked because this child is very overweight, but actually, as much as the carer was concerned, their family situation was just so difficult that they just didn't bother to engage. The specialist school nurse, as I said, has the opportunity to look at the whole history and the whole context of the child, and found that actually there were issues in that family. That child had lost his mother, and actually prior to that, there'd been a series of cases of domestic violence and mental health in that family. And since the mother's died, the older sister is now taking care of that child and 3 other children. And so it's not surprising that actually, on top of everything else, getting a letter to engage is probably the least of their problems. But with that background information, the school nurse was able to contact that family, have a really good conversation with them. The family agreed to be part of the level 3 service, but also is receiving other services from the voluntary sector. And it's, as I said, it's a whole systems approach we really want to enforce with this. So, as I said, we're still learning. We're trying to generate evidence for the future. We've had this 5-year opportunity, and we need to make the most of it. And so we are trying very hard to collect as much data as we can. But also, this is an opportunity for us to share what we've learned so far, and we're doing that locally as well, because we recognize that we are learning things which are not just pertinent to obesity, but other services as well. And we hope that our next batch of commissioning will be even much more informed about what we need locally. So that's it.